This is Anthony Cave, your physician anesthesiologist and integrated medicine specialist. I'm here today to answer a lot of listener questions on the Vegas rules in the operating room. I'm here with Karma, as you can see, our 5-month-old puppy, better than most medications out there for helping protect her health. We'll talk about her in other videos. Let's go through these questions now. We got a lot of them. OMG, I proposed to nurses, OR techs, etc. They all laughed at me. Well, I've been proposed to once or twice. You can tell my wife, it's okay, she knows. Don't get too embarrassed, Lee Dorn, not alone. Chronic pain is not a crime. I like your username, it's true. I had a crush on my surgeon, so I'm really worried I said something embarrassing. Well, maybe you did, but it's okay. Like I said, it won't be the first time, definitely won't be the last time someone has had something funny said about them. 59. Do you ever tell your wife or girlfriend? Wouldn't you like to know? Kristen Jury. When my dad was waking up, he asked for KFC. That's really good, because if you're waking up asking for food, you're probably not nauseous, because it's hard to be nauseous and hungry at the same time. I like to do that with patients to help give them some thoughts about digesting food faster so they can wake up hungry and less nauseous, because nausea is a serious problem after anesthesia, as you probably know. I never said KFC before, that's an interesting one. Only 1 mg patch. I'm sure I've said plenty. I'm sure you have. Belinda Thomas. Oh yeah, I told the cutie pie male nurse I was gonna take him to Myrtle Beach. I don't know where Myrtle Beach is, that sounds pretty fun. Lisa Rhea. Okay, I'll never have surgery again. No, that's not the point. You should have surgery if you need to. These are not things to change your health, just things to be mindful of so that you can maybe tell your anesthesiologist or surgeon ahead of time that, I might say something funny, don't worry about it, versus not having surgery again. Please, please, please don't do that. Jackie Greenfield. Well, geez, thanks for the embarrassment ahead of time. I bet you guys crack up on your lunch breaks together. I'm not gonna refute or deny that, Jackie. User. The truth. I cannot tell you how many proposals I've had. Gosh, I kind of want to know more about that, user. Gianna, do they pass gas too? Well, yes, you talk under anesthesia before you're intubated, of course, and you do pass gas and other bodily fluids as well, Gianna. So nothing to worry about. We see it all the time. I don't want you to be worried before your surgery about that. Amy, I told my hot doctor to have an affair with me. Ugh, so dumb. Amy, don't feel bad. Not the first, not the last. I promise you, from what you've seen here, if nothing else. I told him that I was gonna run over him with my truck. Mochi Mama, that's funny. I had a patient once tell me that as well, and I thought it was weird because who would tell their anesthesiologist that they were gonna run him over in their truck? They asked me specifically what car I had so they could find it in the parking lot. Really weird, but I guess there's more than one patient like that. Char, LOL, I told my doctor I loved him. And my daughter, when she had a C-section, looked at her baby and said, it's alive! Many surgeons and anesthesiologists, myself included, have had many nice things said to us when the drugs are on board. All right, Bill Rothfuss. No. Oh, Jesus. Well, good thing no one knows what you said there, because it's Vegas rules, right? Amberly Summer. Apparently, I really hate monkeys, because under general anesthesia, that's all I kept saying. Well, I don't know what surgery you were having. I don't know if you were dreaming about monkeys. Maybe someone kind of incepted it in your brain before you fell asleep. That can be done under anesthesia. Future video on that, so check it out. But pretty funny about monkeys and general anesthesia. I wonder what you were having. Ona says, my sister told me I yelled at her to get the cow out of the room. And for what reason, I don't know. I told her to beat up any cows that come into the hospital room. Lots of animals here, monkeys and cows. Interesting. Catherine Gibson. Before surgery, the anesthesiologist asked my husband if he's allergic to anything. He said, only my ex-wife. Clever, Catherine. I like it. Sano, 62. I'm asking for duct tape if I ever go under again. We actually tape some of your mouth with the breathing tube, so you'll get plenty of tape. Don't worry, but we won't use duct tape. I don't, no blisters or anything around your mouth. You'll be good. Dazolam and propofol makes me chatty. I'm a natural redhead, so I don't go under as quickly as some others. Suzanne, you're right. Redheads can have some resistance to some types of anesthesia. Future video on that, so you might be one of the chatty ones. That's true. User, when I came out around 2 weeks ago, I was screaming, trying to get off the bed and crying for help. I was mortified when they told me. No idea why I did that. Well, user, I don't want you to worry about that. Delirium after anesthesia is not uncommon, happens a lot, and we take care of you to make sure you're safe. We don't take it personally. We understand it's the drugs, not you. Oh man, now that you say this, I really want to know. No names, give us quotes. Future videos, subscribe to learn more. Princess, I work as an ortho nurse. Thank you. I needed surgery. My favorite ortho surgeon had to do it. I told him now I had the biggest crush on him and his accent makes my knees weak, but he'll fix them for me. The OR nurse told me this after I recovered. That's a good one, Princess. I hope your knees feel better after your surgery. Lynn, I asked if it was okay for me to go to sleep. Lynn, what a well-behaved patient and very polite as well. I wish others were like that. Angela Mary, PACU nurse here. Very good. I just had emergency surgery for the first time and was given Midazin on my way to the OR. Couldn't stop giving people peace signs. Well, Angela Mary, thank you for being a PACU nurse first and foremost. Super important job. All your patients really appreciate it, and so do your anesthesiologists. I'm at least speaking for myself here. I love my OR nurses, especially when they're awesome, like I'm sure you are. Midazin, strong stuff, so peace. April Balazil, I would hate to know what I said because I've had so many things done. Everyone knows me. Oh no, I am embarrassed. Well, April, I don't want you to be embarrassed because you're not alone in saying things under anesthesia in the operating room. If you've said something before, you're probably not the first one and you're not going to be the last one to say it. So I don't want you to be embarrassed. Happens all the time. Lynn Light PhD. When my dad was coming out of it, he looked at my mom and said, I don't know who you are, but you're cute. Want to help me break out of this place? That's, a lot of escape artists out there trying to get out of the operating room. Usually we see it in kids trying to get out, but in adults as well. It's a pretty good one. Black Lives Matter. When I received my epidural after 12 hours of back labor, I admit, I told the handsome anesthesiologist from Tennessee that I loved him. I wish I was from Tennessee, but I guess it wasn't me. But I'm happy to hear your epidural worked, and I hope you had a painless delivery after that. Jill R. You can say just not their name. Aha. You're right, I can share some things and not violate patient privacy. Maybe future videos will have some more specific things that I've heard. We'll see, some juicy stuff potentially. KJ Gillenwater. LOL, I was told that I was really nice when I came out from anesthesia. Guess that is not the norm. Well, KJ, many people are not nice waking up. Just the other day, I had quite the delirious patient waking up, but I love gentle patients when they wake up. It's fantastic, and I'm happy you were one of them. I'm sure your anesthesiologist appreciated that as well. My doctor said I woke up and asked, are you all going to get started now? I also told the nurse I liked her shoulders. Wonder what her shoulders look like. Would you say that about my shoulders? I don't know. Alex says, apparently when I was coming out of it, I kept telling my surgeon that I was in love with him. He was blushing so much. Well, yeah. Alex, like I said, not the first one, not the last one. A lot of us doctors get great compliments with the drugs on board. Jean Tackett. So my coworker wife is an OR nurse. I had surgery about 3 weeks ago now. I know why he looks at me funny. Now I wonder what I said. Well, I wonder what you said too, but too bad I don't know and nobody probably ever will know because of Vegas rules. Irish Cats. Patients can't say much when they're intubated. Very true. However, before you're intubated, you get some anesthesia. In some cases, like I said earlier, never have a breathing tube placed, so you can chit-chat a lot during certain cases, depending on how deep you are under anesthesia. Alice Chase. I had a meningioma years ago, and I talked about the best gin and tonic. I was turned into LOL. I want him, stat. I don't know who you're referring to, but for those of you who don't know, stat means like right now. So I want him, stat means I want him right now. I don't know who him is. If it's me, why thank you. Dame Moody Wench. Stop being cute then, LOL. So I hope you all learned from this, and that if you have any other questions, please leave them below. Leave comments below, subscribe to learn more. Remember, you have more power over your surgery than they want you to know. So keep asking questions, because the better prepared you are, the more you can take control of your outcomes after surgery. More than your surgeon can help you, more than your anesthesiologist can help you. You can do it, but you have to learn what to expect. Subscribe below, keep following, stay safe.